morning. This is Dr. Prince Samuel. Now we have gathered here to discuss about the case study of heart failures. Generally, around 60% and above people in the world die due to heart failure. And the remaining percentage is due to accidents or some kind of organ failures. Now we have to do a case study why this heart attack is happening, why heart failure is happening even in the young stages, and what are the preventive measures to detect this and avoid the death. Let's start the discussion now.
Introduction. Heart attack is still one of the leading causes of mortality worldwide. Early detection and intervention are critical to reduce the death and to improve the patient monitoring. This case study explores about the wearable biosensor, IoT, and cloud analysis and machine learning for the early detection and real-time monitoring of heart attack.
Okay, the problem statement of our case study is globally 17.9 million people have died due to cardiovascular disease. Among this, 32% of people have died deaths of among them, and according to this, 85% people have died due to heart attacks and strokes. In olden days, the average age of first attack being in the age of 53, but now being caused by the small ages of peoples. And the major challenge of this problem statement is late arrival hospitals and lack of real-time monitoring and etc.
The objective of this case study is to develop an intelligent heart attack detection system that can continuously monitor key health parameters like ECG levels, heart rate, blood pressure and oxygen levels through wearable sensors. In the wearable sensors, the collected data is analyzed by machine learning models to detect an early signs of myocardial infarctions. Once an abnormal pattern is identified, it timely alerts the patients or caregivers or doctors. It helps to reduce accidental time and improve survival time.
The system design of this case study contains various components like wearable sensors, IoT systems, and the alert notification system. The wearable systems contain to measure the ECG, pulse rate, heart rate of the patients, and then the IoT system is used to transmit data securely to store in the cloud system in hospital, and an alert notification system is used to give the real-time emergency details to the patient and doctors.
Challenges for this problem statement: due to patient movements, make signal noises, privacy must be protected, and high cost limited usage. This is the main challenges.
Let me conclude this case study. So overall, this case study demonstrates the implementation of IoT sensors and AI models to detect the early stage of cardiovascular attacks. And instead of traditional methods like scanning the ECGs, scans from ECG scans from the hospitals or symptoms, we can adapt this method, as this method involves the real-time monitoring and continuous monitoring of our heart activity and alert us whenever there is an mismatched signal. So according to a newspaper from America, nearly for every 40 seconds each person in America having a heart attack. So if we implement this method using IoT and embedded systems, that can be prevent a lot of lives, and hence this case study implements major role.
Actually, I would like to add some few more points. Generally, the implementation of AI plays a very vital role, particularly in the medical field. So we have to adopt some training methodologies, even and testing methodologies based on the data set. We have to give the data set of a youngster, a school student and aged people. Based on the training models, we can predict the analysis around at what age or what time this may be problem, because nowadays sleep disorder is also a major problem. It is related with heart attack. So we will work on this case study stage by stage project. First we have to train the models, collection of data from the hospitals. As we have discussed, we have already got some kind of set of data from the different cardiologists. Based on those training data, we will find the solution and then we will convert the product and finally into a patent. Thank you, students.
Thank you.